Hello, my name is DeJuan Taylor, and I'm here to inform you more on STIs. STIs are sexually transmitted infections that are just that, infections that are transmitted through sexual activity. STIs have become an expanding issue in today's society because the culture and the people in do not talk about the problems of sex nowadays, especially unprotected. There are a considerable amount of STIs such as HIV, syphilis, and genital warts. There are 3 causes of an STI. One will be bacterial, another will be virus, parasite, and parasites. A bacterial infection will be chlamydia or gonorrhea. A viral infection will be herpes or HIV, and a parasitical infection would be trichomoniasis. When STIs are left untreated, they can be problematic. For instance, chlamydia and gonorrhea can make it difficult for a woman to become pregnant. STIs like HIV aren't curable, but if left untreated, it can turn into AIDS and have the potential ability to kill you. Everyone is at risk for STIs. Unprotected sex doubles the chances of contracting an STI. 15 to 24-year-olds account for half of all new STIs in the United States, with half of 20 million new cases coming in every year. And gay and bisexual men who engage in sex are at higher risk of STI than anyone else. Just because someone is asymptomatic does not mean he or she is STI free. The only way for sure is to know by getting tested. Everyone's body reacts different to an STI. Some may show symptoms while others don't. A proper diagnosis would be made at the clinic. Common signs and symptoms of an STI include discharge from the penis, clear white, yellowish green vaginal discharge, strong vaginal odor, burning sensation when urinating, itching or irritation in the genitals. Clinical tests include a blood test, a urine test, and a fluid sample. Some people may be getting tested going towards a physical, going to their physical, and that would be called a screening. You may not have an STI, but you can still get screened for one. People who are eligible for screenings would be pregnant women, women 21 and older, women under 25 who are sexually active, people born between 1945 and 1965, and people with a new sex partner. Every STI isn't curable, but they are treatable. Antibiotics can cure many bacterial and parasite STDs, such as gonorrhea, syphilis, chlamydia, and trichomoniasis. If one has herpes or HIV, you would be described an antiviral drug. Antiviral drug keeps the virus at bay, but you'll still be able to carry the virus, and you can still transmit it from person to person. Further preventions to take in order to prevent getting an STI would be to use a condom to practice safe sex, don't share needles, avoid anal sex, avoid sexual contact with semen, and don't share items that could be contaminated with blood. STIs are very common, and that's because people engage in sexual activity without being properly educated on the subject. And that has become a problem in America today. There are not enough institutions who provide sexual education classes, which results in a lot of unplanned pregnancies, STIs, such and such, and that's what happens. A little fun fact would be that the STD that is most popular among men would be chlamydia, while HPV is the most popular STI among women. My name is DeJuan Taylor again, and that was my presentation on STI.